Hi, and welcome to my podcast, the Fertility, Motherhood and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. Sakshi sat there in front of me, tears rolling down her cheeks as she narrated her past experience. I was surprised that even 3 years after her childbirth, the wounds were still so raw. I can't look at photos of my son from his first year. It brings back memories of the darkness I went through. There are unfortunately pieces that still haunt me. Those weeks and months of never-ending moments of pain and inadequacy of being such a bad mom. I just can't focus on his incredible moments while I look back. What hurts me today the most is that due to postpartum depression, I lost out on the joy and happiness that he gives me today, that I should have given him the same in his initial months as a little baby boy. That was Sakshi, and I met her more than 20 years ago. As a doctor, I was living in this make-believe world, a fool's paradise rather, I would say. My image of a mother was this giant, enveloping pair of wings that loved you, protected you, and was ever smiling without a frown on her. Sakshi shook my foundation. How could childbearing be depressing? Isn't that what a woman always wants? Isn't that what she feels completes her? Then why the depression? I have learned a lot in these years as my hair turns grey. I realize that even the strongest of armors have chinks, and it's our duty to recognize, realize, and protect that wonderful creation of God that protects all of us, all our lives. I have here with me Mrs. Shubhika Singh. She's a consultant psychologist with both her bachelor's and master's in psychology from the UK. She has been practicing for over a decade at her private clinic, New Leaf, Mental Health and Well-being. She also consults at various organizations and has recently launched innercraft.com. I first met her at a program where we both shared the same dais. I listened to her speak on the ever-raging mother-in-law-daughter-in-law relationship and felt that if one counseling session could be gifted free as a part of a marriage deal for every couple, we could avoid zillions of such fights in every household. I have worked with her closely the last few years and have become a great fan, not only of her professionalism, but her eloquence and her innate ability to calm down even the most anxious of people.
That is very kind and generous of you, Dr. Agarwal. I'm eternally grateful for our association.
Thank you for being here, Shubhika. And before we move forward, would you tell me a little about Inner Craft? What is it about and what is its motto, or how is it different from New Leaf?
Sure, Doctor. So New Leaf is very dear to my heart. That's what I first started my counseling practice from, with a mission to create a positive impact on people's emotional health. So counseling involves exploring feelings, beliefs, and relevant events, sometimes from childhood and personal history, in a structured way that a trained person is there to help you do it safely, without judgment, as well as provide therapeutic interventions. Over the years, I've supported individuals with depression, anxiety, trauma, suicide, relationship issues, bereavement, abuse, and stress. Innercraft.com is a digital platform to provide mental health solutions with videos and content and articles.
I know where you're coming from, Shubhika, because I've sent innumerable patients, friends, known people to you, and they've all come back so relieved and so thankful of having gone to you in the first place. So, Shubhika, if we come back to the discussion of today, what is this postpartum depression?
So, Doctor, first of all, thank you for bringing up this topic, because there's much needed awareness required on postpartum depression. So, postpartum depression is a serious mood disorder that affects women after childbirth. It creates feelings of sadness, anxiety, depression, and exhaustion that can significantly inhibit their ability to care for their newborn child. So, let me explain this better by sharing a real life experience of one of my clients who I've taken consent from, of course. She said to me, I cried all the time hysterically and just could not connect with my beautiful baby. My baby cried all the time and hated being put down. My husband was so busy working that he was hardly available to us. I felt like I was going to break down, like physically fall apart from all the exhaustion and mental turmoil. All I wanted was to escape from her. I felt I was never going to be happy again. What was supposed to be a beautiful place was suddenly so negative. I never knew this was even possible. I felt too ashamed to ask anyone about these feelings. But one afternoon, I felt a sudden urge to harm my daughter. And that's when I immediately called and confessed what I'd been going through to my sister.
Wow, I mean, this is so overwhelming, Shubhika. And as a doctor, if I hadn't actually met such patients, I would have never believed what you said just now to be true. I mean, who would ever believe that a mother would ever harm her own child?
Yes, that's true, because it is hard to understand it, especially more because as being a woman, it's strongly linked to love and care, and one doesn't associate this gender with harm.
Very true. I do have something to ask at this point. Motherhood is itself a difficult task, giving birth probably even more so. It's a whole new world, and the huge change it's going to bring into someone's life will obviously be dramatic to say the least. Going back home from the hospital with a tiny newborn, excited yet apprehensive about the changes ahead, lack of sleep, responsibilities. Won't this, anyways, be depressing for most? Is this postpartum depression then?
Yes, that's a pertinent point, Doc. The initial days of motherhood is overwhelming and challenging. However, a new baby is supposed to bring happiness and joy to a family. Everyone is busy celebrating and expecting the new mother to be over the moon. But despite trying, she finds it hard to. It's very confusing when the rush of emotions is worry or sadness instead of happiness. Most women can relate to the roller coaster that their emotions dominate in the first few weeks after a baby is born. Add to that perpetual tiredness, lack of sleep, absolutely no time for self-care and hormonal changes, and it comes as no surprise that most women feel a bit down, fearful, or anxious in the first few weeks after giving birth. This is referred to as the baby blues because it takes time to adjust to this new life. When the symptoms last longer, along with the ones I will be describing shortly, then a person may have postpartum depression.
Okay, so are there any underlying reasons why one would have postpartum depression? I was telling someone the other day that I'm working on a podcast on this topic, and the person asked me, is it because of the woman herself? Was she always depressed to start with? Or is it something that family and circumstances bring her to?
I'm not surprised that someone asked you that, Doc, because there's such little awareness on mental health because it's an invisible illness. It's great that you have chosen to do this podcast today. And unfortunately, the exact cause of PPD is unknown, but there are several contributing factors such as hormonal fluctuations, having a difficult relationship with the spouse, stressful life events during pregnancy or soon after, such as death of a loved one, or maybe critical illness of a loved one, domestic violence. In one of my clients, it resulted of her own childhood trauma of sexual abuse. When she gave birth to her daughter, it triggered it off. And for her, it was like her worst fears were going to come true. And she was so terrified. And along with these, there's worries about finances and life issues. As well as sometimes there's maybe a previously diagnosed or underlying depression that can increase the risk of postpartum depression. And often one sees signs of depression emerge during pregnancy.
This is very interesting, Shubhika, now that you bring it up. If you remember, I had sent two women to you last week. The first one was in her second month, and her husband was telling me how she was getting intensely emotional and depressed. And the second lady was in her fifth month and said that she just couldn't stop crying at the smallest pretext. So, what are the signs in pregnancy that couples should be watching out for that could warn us about an impending postpartum depression?
This is such an important question because recovery is also linked with how soon one starts treatment. So the initial symptoms differ from person to person, but some of the common ones that usually presents itself during pregnancy are frequent crying, like your patient who you referred to me, worrying constantly about the baby or your own body weight, thoughts of being a bad mother or a terrible parent, persistent sadness, loss of enjoyment in activities that she previously enjoyed, changes in sleeping and eating patterns. One of my clients experienced this during her second pregnancy. In her first one, she had no depression or anxiety at all.
In fact, when you say this, Shubhika, the example that you had given, funnily or ironically, I would say, I have a patient right now in her second pregnancy, and she's worried that if she has a daughter, she has a son previously, that she says it's so difficult to bring up a daughter, and then, how am I going to deal with all the sexual predators out there? She has this weird thing in her head that if she has a daughter, her daughter is going to be unsafe. I don't know if she's had any bad experiences in her childhood, but every time she's scared that if she's going to have a daughter, and not because of the fact that, some people have this thing that, I don't want to have a daughter. A daughter is inferior than a son. It's not because of that. It's just about that scare that she has in her head. How is she going to bring a daughter up? It's going to be so much more difficult.
Right.
And the daughter not being able to go out like a son does, or she's having sleepovers at friends or whatever it is.
Right.
So I suppose with such a parent or such a woman going through her pregnancy with so much of fears, she will probably have more trouble after she delivers.
Right. I mean, it just adds another complexity to already what she's dealing with. And I also, since you brought up this sexual abuse for youngsters, the statistics show us that it's only 1 in 6 girls and 1 in 3 boys who get molested or taken advantage of before the age of 18. So the statistics for boys is also very high.
Something that we don't address
and
really.
We don't address it enough. We always think ladka hai so he's safe, but many boys actually confess when they're much older, and that is the stark reality in the world we're living in. So one needs to be protective of your daughter as much as your son.
True.
So Dr. Agarwal, you're seeing couples day in and day out. And I also feel the role of a husband is extremely critical in the way the wife's happiness is handled, her confidence, as well as her mental health issues of, the motherhood and what challenges are in front of her. I remember a client telling me about her husband who saw this time of her pregnancy as party time to relive his bachelor days. He was going out 3 to 4 times a week by himself. Another one of my clients felt really insecure and low because her husband would keep saying mean things to her about the way she looked. So what advice would you give the dads to be?
Interestingly, Shubhika, I became a gynecologist after I got married.
Oh, wow. Okay, I didn't know that.
So what my wife, Saroj, couldn't train me for, this profession did. I feel I'm far more compassionate as a gynecologist than I was ever before. I keep telling husbands that if men were to ever experience pregnancy, forget about labor. Babies would cease to be born. I can't even begin to explain what women have to go through by way of periods, associated problems, infertility, pregnancy, responsibilities of motherhood. It's a lifetime commitment. And what do we as men need to do? Provide sperms. So we have a very small biological role to play. But we could and should compensate by playing a much bigger emotional role.
Right.
Trust me, most of the times, it doesn't take too much to make a pregnant woman happy. I once had a patient tell me that, Doc, I deal with nausea, backache, and every other horrible symptom through the day, hoping that when my husband comes back in the evening, he will sit me down and ask me, how my day was, how am I feeling, and if there is anything that he can do to make me happy. That's all women need. A short drive, a little love, and a bit of understanding. I felt she had summed up the needs so very beautifully. Another area of conflict I keep encountering is a holiday. Most pregnant women want one because they know they have difficult times ahead once they deliver. From the Japa torture to 4 years of nappy changing, babysitting, their lives are going to change, and how. It's not too much to ask, is it? If we men just keep this in mind, that pregnant woman is making one of the biggest sacrifices in her life to give us that bundle of joy. If we understand that gratitude, I feel the rest of it will all fall into place. We men need to really keep our mothers and wives on the highest pedestal possible for all that they willingly suffer for us.
That's so beautifully said.
Yeah, I know. That she really made it sound so beautiful. So, I guess from that perspective, my words would automatically come out. And as I said, my profession has taught me a lot. It really has. Although my wife doesn't agree to that.
Amazing. I'm sure she does.
So let's move on to the sphere of postpartum depression now. What are the symptoms of it and how does one know?
As we have been talking about pregnancy and birth, they are intensely emotional events and present challenges that make one feel sad, tired, and anxious. But we mustn't confuse postpartum depression with baby blues. In postpartum, her daily functioning is affected, her relationship with the baby and other family members, making the new mom feel increasingly isolated. The onset of PPD is usually within the first 2 months and can go on for up to a year after giving birth. So the symptoms include, apart from the ones I've mentioned earlier, are intense irritability and anger, not interested in bonding with the baby or care for the baby, depressed moods or severe mood swings, overwhelming fatigue or loss of energy, diminished ability to think clearly or to make decisions, and thinking about suicide or thoughts of harming oneself, and sometimes even of harming the baby. I remember the description vividly of one new mother who was 28. She had longed to be a mother her whole life. She said when she would feed her baby, she would doze off and go in and out of sleep, especially during the night feeds. But she saw herself hurting her baby. As she came out of the shock, she was so relieved to see her baby was safe in her arms, but was engulfed with so much guilt and shame for even having these flashes. When this reoccurred 7 to 8 times, she became suicidal because she thought she was a terrible person. What mother has thoughts of harming her own child? She felt a strong urge that she didn't deserve to live, and her baby gets another new, better mother. She felt too ashamed to even share it with another person, for fear of being called a bad mother or unstable person. But fortunately, she sought help and support, and today she's in great mental health and on her way to having a second baby. So symptoms of postpartum depression, or PPD as I've been calling it, vary from one person to another, and one must seek support as early as possible because 1 in 15 mothers go through this. And if there's any mom listening in, you are not alone.
1 in 15 is actually a big number. So as a doctor, I know that hormones are all over the place during pregnancy. How does a would-be mother deal with it? How can her family be supportive? And what do you do when you encounter such a scenario?
Doc, I think the first step to it is to be able to recognize that something is going on which is not okay. And for this, we need to create awareness in India, not only for women, but also for families. With awareness, women will no longer have to suffer in isolation, shame, and silence. Hence, it's equally important for new fathers and caregivers and family members to know so that they can be supportive and ease her. I often hear from my clients talk about some hurtful comments said to them by the women around them, such as, "What kind of a mother are you? God should have never made you a mother." So this girl is left feeling more inadequate and burdened. Often these harsh comments come from having no understanding of PPD, poor interpersonal relationships, or just low empathy. If you are a mother, mom-in-law, sister-in-law, or sister listening today, be kind to the new mother in your family. Your loving support at this time can really be soothing for her. Remember, her journey and experience is not the same as yours, and it can never be. So avoid comparisons. She needs you and your love. It's also helpful to seek advice from a trained professional who can guide the family members along with the new mother. At New Leaf, I strive hard to make clients feel comfortable so they can share their innermost and sometimes dark thoughts with me, so we can heal together with appropriate therapeutic interventions. I often even encourage my clients to join online support groups for PPD because it's very comforting to know that you're not the only one going through this and can talk to those who have been through this journey before. So to all the ladies listening in today, talk to your gynecologist, family GP about your concerns and get a referral to a good psychiatrist and psychologist. And Dr. Agarwal, here I must say your efforts and approach to pregnancy, addressing the nuances that come along with it, including mental health, is dynamic and commendable to say the least.
Thank you, Shubhika. I guess I owe it all to good upbringing by my mom and good training by my wife. But yes, I do understand that the taboo which was there regarding mental health, I won't say it's completely gone. Of course, you're the expert, you're seeing more people. But when I even talk about referral to a psychologist or a psychiatrist, the resistance probably that I had or felt years ago is much lesser now. So the people are more willing to talk. Of course, yes, they don't really come forward and say, "Oh, I'll make the call today or I'll make the call tomorrow." They always do say, "I'll give it a week's time. I'll try and see if I can manage myself. If I can't, I will make the call." A lot of them do, which is positive, which is a good thing.
Right.
So thank you so much for shedding light on postpartum depression and the role of family. But how does the new mother cope with this? How do you deal with this storm when it hits you hard?
So the suggestions I'm about to give are not an alternative to treatment, but more as a support to herself to feel better. So again, like you just said, doctor, that, a lot of times your clients and, your patients say, "Oh, I'll handle it myself." But would we ever say this for when we had fever or stomach ache for longer than a week? We wouldn't. So likewise, for mental health as well, don't subject yourself to that emotional pain week after week. There is support available. There are good qualified professionals available to reach out and try it for yourself. So coming to some suggestions for PPD. So if you're a mother listening in today, this is for you. So as a new mother, you must feel like you have no time for yourself. But you know what? You must make a little time. So whether that is for enjoying a soothing cup of tea, listening to music at home, or just stepping out of home for a walk or to meet some friends. A little me time can be very, very calming and soothing. And let someone else watch the baby during that time. Number 2, get adequate sleep. I know it's never enough, but to get the most, make your routine closest to your baby's schedule. Third point, be open to taking help. Trust your spouse, parent, in-laws, and friends to look after your baby like their own. Let them help in other ways otherwise, like run errands, do things around the house, or watch the baby while you sleep. Sometimes going into counseling and therapy can also be revolutionary. not only will you feel supported, but also you will be able to work through any issues and learn techniques to overcome them. So that was point number 4. And lastly, point number 5 is avoid isolation. Talk to someone who you can trust and who will be there for you when you need to talk or cry. This is a part where you may need to push yourself a little bit. Have some close people do check-ins on you, where they check on you via message or call on how you're feeling, so that you are bound to respond and stay connected.
That is so helpful. I'm sure women out there will find a lot of solace and good information out of this to stay out of the gloom of postpartum depression. Pardon me for saying this, Shubhika, but time really flew with you without me even realizing it. And honestly, I can't thank you enough. I don't think anyone else would have tackled this rather difficult topic as brilliantly as you have. Before we end, any concluding thoughts from your end?
Thank you so much, Dr. Agarwal, for having me on your podcast, and I'm really excited to hear it myself. So some thoughts from my end are postpartum depression is a real illness. Some people experience milder symptoms while others have more severe ones. But having PPD is not the new mother's fault or a result of a poor mental state. The new mom feels so alone and isolated when she's battling postpartum that families should be understanding and not shaming or stigmatizing her. This can be hugely beneficial for the new mom to be, because PPD is affecting her ability to enjoy the baby and potentially impacting her ability to function at all. So seek help and support. The ray of hope here is that this isn't permanent. With time and help, she can return to normal routines and feel like herself again. So to all the new moms listening in today, prioritizing some time to look after one's own well-being is imperative. As the saying goes, you can't pour from an empty cup. And remind yourself daily, you are an amazing and loving parent who is doing a wonderful job.
Thank you, Shubhika, for the advice. And that, my friends, is wrap-up time for yet another podcast episode. I hope you enjoyed listening to it as much as I enjoyed making it. Sushant Singh wasn't the first, but somewhere I think he has touched a raw nerve in all of us and made us realize the importance of mental health. And as Shubhika said, the need to reach out and speak. Do write in and let us know what are your views about mental health as well as this podcast. If you get a chance, do look up my website www.drrajievagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries. This podcast is available on Apple and Google Podcast as well as Spotify. Do subscribe and leave your comments and suggestions for any future topics on the Apple Podcast app. That's the only way we can make this better. Looking forward to great interactions. Keep listening.